This is David Boschken calling from Northern California, Los Altos specifically. Tonight we're going to talk about really increasing your case acceptance using micro-osteoperforation and high-frequency vibration technology. This has definitely been an evolution for me, and I've been using some form of accelerated orthodontics for about 17, 18 years now. And I'm excited to kind of talk to you tonight about kind of the latest information out there with respect to micro-osteoperforation, high-frequency vibration. Tonight's pretty fast pace. We only have about 45 to 50 minutes on my end to speak, and then we'll do some Q&A at the end and answer any questions that some of you may have. In terms of who I am, I've been using or been an orthodontist for, I guess, 17 years now. From California, went to Berkeley, went back east to Penn for dental school, and I also did my orthodontic residency at Penn as well. So I'm a double Penn grad. I'm sure there's a few of you on the call as well. When I moved back to California, I bought my first office within a few weeks. And within a few weeks, I was called by Zia Christie and Kelsey Worth, who were the co-founders of Invisalign, and they asked me to come to their headquarters at the time and talk to them about Invisalign and see whether or not I'd be willing to start training orthodontists on the product. We had all been trained at Penn in our residency in 1999, but in terms of starting cases, we really didn't have much experience in that initially. It was really in my practice that I started with Invisalign, and fairly quickly, I guess I was the expert in the room. I remember my first lecture I gave for Invisalign, which was probably mid-2000, late 2000, and I probably had maybe 10 cases under my belt at that point, or 10 cases started. I'm not even sure I had anything finished at that point. And there I was lecturing and training doctors, orthodontists on this product, and there was something very surreal about that, being the expert in the room and really not having a clue what I was doing or where this product was going. So in terms of, I'm on Alliance Speakers Bureau, again for 17 years I've been there. I've been on Propel's Clinical Advisory Board and a KOL member for about 4 or 5 years now. I've had numerous consulting services, training and general dentists and orthodontists on Invisalign and doing consulting on their clin checks. I've probably in the range of consulted on 25,000 clin checks. Most of that volume came from Invisalign. There was a company that we had created called General Orthodontics, which was then bought by Invisalign. This is all 10, 12 years ago. And then Invisalign was offering complimentary consulting for all general dentists that got trained. And so we would just wake up in the morning and I'd have probably 50 to 100 cases to review on a regular basis at Invisalign. Eventually Invisalign decided they didn't want to be in the treatment planning business, so they got rid of the company. And of course, since then, a lot of other companies have sprouted up over the years on consulting, which has been great. I have 2 private offices that I own, one in Los Altos, one in San Jose. I have treated over 3,000 Invisalign patients myself. I don't have an associate. I probably am not the smartest guy in the room with respect to that, but I've always wanted to kind of control it myself. I am a member of Derek Bach's Pragmatic Orthodontist Elite group. I think it's a phenomenal geo-specific group. If any of you are kind of on the fence thinking about it, if your area is not locked up, I would highly recommend getting into this group. There's a lot of study clubs that are out there that ultimately dissect through Invisalign and Propel and everything orthodontics and everything marketing, and there's some great ones out there. Having that sort of very unique, specific, we all kind of know each other group where we share everything, our good, our bad, I think has been invaluable. it's almost like another residency that essentially we're all going, through. I've been around the block for a long time. I've treated a lot of Invisalign cases, a lot of Propel cases. I'm still learning. There's no part of this that I feel like I've actually nailed it, and I can just sleep at the wheel or and not pay attention. There's always something creatively that somebody's offering. There's always some case that stumbles me. I've often found that the easiest cases end up being the hardest cases, and so our journey should be constantly, until we finish our last breath, should always be about constantly learning, constantly making ourselves better, and also promoting that great goodwill with all of our colleagues out there. We're a close-knit group. We should all support each other. All of you are welcome to come see me in my offices if you want. Just reach out at the end to my email and kind of see how things roll in my office. As a disclosure, I am not employed by Propel. I do own stock in this company. I have had that for about 4 or 5 years now, and I am obviously paid for these presentations. So with that said, you take this with a grain of salt. I'm definitely on board with the concept of Propel and micro-osteoperforations and high frequency vibration, but I also tell it the way I see it. And if something's not working for me, then I'm gonna find a way around it. So that's respect to that disclaimer. In terms of my team, I think these are kind of older pictures, probably a couple years old. I think I have at least 3 more team members. I'm up to 15 at this point between my 2 offices. Great group of gals. They make me great. I certainly owe a lot to them. This is primarily my San Jose office in that picture, but this is sort of a combined picture of both offices from, I guess, 2 years ago. I think I've added maybe 2 or 3 more team members in this picture. But just, we all have fun, and that's what this is all about, is being in an environment where we love to be with each other. We come in every day, we laugh, we have fun, patients see that, and that's really all that matters at the end of the day. We're doing great work, patients are happy, team's happy, and that just makes all this, I think, so rewarding. I am in the process of rebuilding my Los Altos location. I had to leave over a year ago my other location, and so I ended up buying a building in downtown Los Altos, and I actually tripled my square footage from 1,100 to 3,300 square feet. So this new office is pretty big. It's actually bigger than my San Jose office. So we're doing kind of in the middle of construction. I did a sort of bachelorette night where I presented flowers to each one of my team members as a way of sort of thanking them for this construction. I don't know if any of you have been through construction yourselves, but it's stressful. And certainly with this new office, I rebuilt my San Jose office about 11 years ago, which is this beautiful office, but it's nothing like this new office. This new office is, of course, all Apple, but it's reclaimed wood, concrete floors. Everything is very systematically kind of laid out, and so we're just about to move in the next month or 2. This is a picture of my San Jose office, my reception room. Used to have a saltwater fish tank over there where the coffee bar is. Had that for 10 years, and then it started leaking, and then they gave me a bid of $10,000 to rebuild the tank, and I was like, I don't really get a lot out of the tank. So I went on Pinterest, and I found this perfect sort of coffee bar look, and I got to tell you, big reward. Patients love it. Moms love it. Fresh fruit, coffee. We have the Flavia machine over there on the left, which is owned by Mars, and great coffees, teas, and all that. So anyway, so this is sort of this was built 11 years ago before I got tops. So you can see where my old charts used to be. Probably within a year, we actually bounced out of charts and went completely paperless. So I have to use that chart area for something. So it looks like Buzz Lightyear's over there. And this is they check in at the iPad. And those of you who have tops, obviously, looks pretty familiar. And this is how we flow. 80 patients, 90 patients a day through the office. is that systematic flow that works out well. This is also why I'm always so excited about aligner therapy, about Propel, because it makes me more efficient, it makes us streamline better, and it makes us get done faster as well. So that, I think, has been really rewarding. So why did I start all this? Like, what's the whole point of this? Well, if I had more time, I'd go through Simon Sinek's why. I've been talking about him for probably 3 years now. Everybody else has talked about him to death, so I won't really bore you on that. But the bottom line is that I always knew that my why was always about customer service. That's what I'm all about. You're going to get straight teeth. You're going to get this gorgeous smile. You're going to be happy for it. I guarantee it. Like, there's just no other way to look at it. I'm not going to stop until I get everything perfect or until you tell me to walk away, and I will at that point. But, you know, for me, I've been a big Damon user since my residency. I went to Penn. Over at Temple, there were the Damon, you know, relatives that were in the Temple program. So we at Penn started using the Damon initial brackets. They were the size of a tooth back then. The doors would break. We used speed. Obviously, we did everything else from beg to tweed to everything else. But I came into my residency, out of my residency, into my first office, and really started thinking about what bracket system that I really wanted to use. So you really use kind of what the existing doctor has. So he was a standard edgewise typical doctor, and so I used him for a while, and then I went into tweed for a little, or not tweed, excuse me, speed for a little bit, and then I was like, I got to go back to Damon. So I've been a real strong Damon disciple for about 17 years now, and I love it. It's easy, it's straightforward, it's cookbook for me. I get the results that I want. Invisalign has been a similar journey. I've always pushed the envelope with Invisalign, but at the end of the day, either the product quality wasn't there or my patience wasn't there. But about 5 years ago, I started doing less Invisalign on these crazy cases. So it would be these class 3 cases, class 2 cases, 4x extraction. I can treat those any way that I want with aligner therapy. The problem is it takes time. And with all of the G1 to G7 advancements, with all of the, you know, pimping out your ClinCheck treatment plan to it being as automated as you can, at the end of the day, you rely on your patients to be compliant. You rely on a polymer material. You rely on attachments. You rely on so much that at the end of the day, you don't always get to what you want with aligners. And that's where refinements come in. And before you know it, your ROI comes down to $100 appointment. You've seen them 30 times, and you realize, why? Why did I do this? Because it's just not making a lot of sense. So I really started doing less Invisalign about 5 years ago, and doing those cases with Damon. And Damon Clear and all that, and I got the results that I wanted. What kind of pulled me back from all that in terms of my why, and delivering that amazing customer service and giving the patients what they want, which again, these patients are coming in wanting aligners, and I'm trying to switch them into braces, is what changed all that was accelerated orthodontics. I've been using Wilcodontics for years with my periodontist, but it was sporadic. It was hit and miss. The periodontist wants $8 grand for their corticotomies. There's lots of pain. There's Vicodin. There's Jack Daniels that are all associated with this. It's just not. It's not a happy place. It's just not, you know, that screaming why customer service experience you're trying to achieve. And that's where I think Propel has been you know, transformative for me. And in terms of what Simon Sinek says on that, you know, at the end of the day, you know kind of what you do, you know kind of how you do it, but a lot of you don't know why you do it, and that's sort of where I needed to reevaluate my why. Your why is not always stagnant. It's not always the same. There's always going to be changes to that why, and I think it's important to reevaluate. And those of you that said Invisalign doesn't work, and you said that, you know, 17 years ago, now you're playing catch up after all these years. And same thing with accelerated orthodontics, whichever company or technique you're going to go out there and use, it's here, and it's viable, and it's consistent, and it actually works. And the more you try different products, the more you realize that that there is more room out there, more space for you to get into, and not just the traditional orthodontist or orthodontics that we do. Frankly, if we do that, we're just going to kind of die in the vine, because when you look at general dentists doing fixed ortho around the country, when they're doing accelerated orthodontics already, when they're doing Invisalign, obviously all around the country, and they're doing cases that are phenomenal, 4x extraction cases that look beautiful. And even though that may be few and far between, we also have to take into consideration the idea that they're doing it. And if we're not doing aligner therapy, if we're not doing accelerated orthodontics, then how does that make us any more of a specialist than the general dentist down the street that's doing all of that? So it's something you may want to consider in terms of kind of where you may want to take your office. Propel's been around since 2009. Clearly, this technology is rooted in a lot of decades of accelerated orthodontics. That sense of creating an inflammatory response and spiking the cytokine levels and really riding that wave. Ultimately, I have an analogy a little bit later that I'll kind of share with you with respect to kind of how I see Propel and how it works. But Propel is an accelerated orthodontics is pretty endemic these days in terms of being in the universities, and obviously white papers being written almost weekly on accelerated orthodontics. Dr. Schumann, Lou Schumann at Pratt Institute gave Best in Class to Propel 2014. Lou actually was my boss at Align Technology back in 2001. He started the Clinical Advisory Board at Invisalign, and he was the one that ultimately brought us initially together, all the initial alpha group doctors that wanted to speak and the initial speakers. And so shout out to Lou Schumann, awesome individual, great individual, great speaker, and just I think a real sort of futuristic thinking kind of guy. And you can also thank Lou for Vivera. Before he left Invisalign, he was the creator of Vivera in terms of that concept, the branding, the marketing, and all of that. So, and those of you who don't use Vivera in terms of the 4 sets of retainers, you need to start doing that. So we'll talk about that later. The science behind all this. What are MOPs, micro-osteoperforation? See, this stuff should be flowing off your tongue all the time with patients. This is rooted in years and years of research. You're really using your body's own biology. You're basically stoking the bone by doing a tiny little micro-osteoperforation, anywhere between 3 and 7 millimeters, through the cortical plates, into the medullary bone. And that alveolar bone in there is soft, as it is. But what you're doing is you're creating this inflammatory response that temporarily softens the bone. Every single perforation that you do has an 8 to 10 millimeter radius effect. So we're not riddling the whole mouth with perforations. You're being selective around canines and bicuspids and maybe a lateral, couple perforations, or maybe anywhere from 4 to 6 perforations per quadrant is usually adequate to get the softening effect that we're trying to achieve. All of this is a natural process. We're not causing any undue skeletal problem to the patient, any immune issues at all. And all of this has certainly been researched to death over the years in various universities as well. In terms of why we use it, well, a lot of the time, people want to emphasize the speed. You can cut down by 50%. I'm not using that argument, and I haven't really ever used that argument. The fact that Invisalign in G7 announced 7-day aligner change only really validated that you can go faster in aligner therapy, in polymer material, or people love to say plastic. Interesting thing is the polymer for Invisalign is actually not a plastic, it's a polymer. But anyway, we can call it plastic if we want. But when we think about what kind of movements we're dealing with, accelerated orthodontics fits very well into what we do today. And so if we try to go faster than 7-day aligners, let's say 3 to 5 days, that's really hard for the aligner to continually grab onto those teeth and get the movements you want. There's a lot of resistance in the periodontal ligament in the bone around the teeth. And so often what this micro-osteoperforation is all about is sort of releasing those challenging movements. it actually allows us to more predictably move through treatment, yes, faster, but more predictably get the movements that we want. So we don't end up having at the end an extended period of time for refinements, either with aligner therapy or with ultimately with braces. So something to kind of consider as well. Who's not a great candidate? Well, on the ASA scale, you know, if you're a 3, you know, or down to 3, 4, 5, 6, you know, that's probably not a good patient. 1 and 2s are fine, but this is really the rate. Anesthesiologists sort of rate these patients based on their responses and their overall sort of organ response and their body response and all that. Anybody who's on chronic NSAIDs or steroids, obviously NSAIDs will slow down or counteract the inflammatory response. And then bisphosphonates, or you know, any of those bone derivative like Fosamax, even though I'm not too worried about having any osteonecrosis issues with these patients, I typically will stay away from patients that are in that window of when they've had those drugs. In terms of what all this does, it creates a localized inflammatory response. It spikes the cytokine production, and just think of the cytokines as the quarterbacks of your immune system. They're ultimately the ones that are incorporating all of those bone cells to turn over that bone faster and ultimately get that response, that bone remodeling response that we're trying to do. This is probably as extensive as I'm going to go tonight into bone biology. Would never, you know, say that I'm an expert on all the ins and outs of all this, but essentially what we do in orthodontics is we provide a tension side or pressure side to a tooth, and ultimately that creates sort of the remodeling, if you will, of the bone. And there's this constant tension side and the frontal pressure side, and when that's in harmony, or as we've said over the years, slow continuous movement, we get the nice flow of teeth through bone. When we go outside of what that bone and that tissue can handle, then we get a necrosis area or a hyalinization zone where the PDL ultimately dies and needs time to rebuild, and you ultimately can't move teeth through that period when the tissue is has been necrotic. And so essentially what Propel does is it does allow us to go faster through this because we don't see the necrosis cell-free hyalinized zone, and we can't go that fast through treatment if we don't incorporate an accelerant somehow. So in terms of what the cytokines are ultimately doing, is they are going from the resorption side to the mineralization side, all choreographed by the cytokines, bringing in more of the osteoblastic sort of movements, and, cells to really soften that bone nicely. Now, in terms of accelerated orthodontics, you know, there's different techniques out there. There's obviously vibration. There's actually light as well. There's laser diode, low frequency light that shines through the bone that stokes the cells and mitochondrials to increase their energy and increase their cell productivity. There is obviously there's micro-osteoperforations. There's corticotomies. All of this kind of stuff that's certainly been out there. The low frequency vibration has been around for a while. That frequency is on the lower side. Patients do it about 20 minutes a day, and that's one way to go as well. The other way in terms of vibration is high frequency vibration. That frequency is much higher. It's about 120 megahertz of vibration. Only requires about 5 minutes a day. This high frequency vibration called VPRO 5 really what it's all about is seating the aligner. So when my patients use this high frequency vibration, the aligners are in their mouth. They are using this appliance for 5 minutes in the morning, and depending on what kind of movements I'm seeing or what kind of difficult movements I'm playing out, I might actually then have them do 5 minutes in the evening as well. Statistically, you don't see a huge difference between doing 5 minutes in the morning, 5 minutes at night, or 10 minutes a day. Usually 5 minutes is fine. I just feel more comfortable, so do patients at times. But it really does decrease some of the issues with aligners not fully seating. And so they're doing this religiously throughout the day, or every day, I should say, for 5 minutes in the morning, 5 minutes at night. Obviously, the old school was the full corticotomies, the Wilcodontics, the surgery, and then, of course, the Manual-osteoperforation, MOX. And so we'll be going through that tonight as well. The manual one, the benefits are obviously, it's the frustration. This was my frustration for so many years, where the aligner technology wasn't where it was at. I mean, back in 1999 and 2000 when I'm starting, it was hit and miss on aligner fit. We were taking PVS impressions back then. The ClinCheck setup was rudimentary. The attachment sequence was completely out of whack, and often they were massively built attachments that were all or none, and if they didn't wear their aligners for 20 hours a day, you were tracking out of your aligners, you know, within a few months. So a lot of that is gone, but there's still that frustration even today with cases dragging on. And many of you, when you quote a patient, you say you're 12 to 14 months, you know, most doctors are not factoring in a potential refinement in that 12 to 14 months. You know, you always want to overshoot a little bit. So if you think it's 12 months, it's going to be 24, 25 aligners, switch them every 2 weeks, you also want to factor in if you're going to do a refinement. And I'm a big fan of refinements. I refine as many patients as I can. Sometimes I can't. Sometimes patients are like, no, I'm done. I don't care about that little tooth right there. And, you know, that's always a disappointment to me. But I love refinements. We've been using scanners as a speaker for Invisalign. We were the first to get them 6, 7 years ago. I got to tell you, whoever's not using scanners, I got to tell you, I think everybody should. If you took my scanner away, I would stop doing Invisalign. I would stop having, you know, outside retainers made. I would stop doing Vivera all around, because the quality finish with scanning technology is really second to none. And so this frustration, though, getting your initial set of aligners are 24, your refinement set of aligners are like 18, and all of a sudden now you're a year and a half, you know, into treatment, and you're still struggling on that canine to rotate it. You're still struggling on that lateral that's not rotating. You're still struggling. And that's where, this is 2017. We shouldn't be struggling anymore on tooth movement. The technology today between fixed ortho and passive or self-ligating brackets today, if that's where you go, and aligner therapy, Invisalign, if that's where you go, the technology is there to allow us to treat so many patients today that we couldn't treat years ago for various reasons. And so what keeps us sort of on our toes and ultimately in the player circle, being able to really define how we treat these patients and at a fast, effective way, I think it's Accelerate Orthodontics. That's sort of the equalizer for me. And so there's two really ways to look at it. You can be proactive and start it in the beginning, or you're going to be reactive, which is halfway through or at the end of treatment, and you're being reactive to a tooth, you know, struggling, and you're dragging out, and you're on your third or fourth refinement. Patients now being frustrated with you. Can't tell you how many times I've gotten towards the end, I'm struggling on a tooth, I will go in there with a micro-osteoperforation, about 3 or 4 perforations around one tooth, and that tooth is right where it needs to be 4 or 5 weeks later. And I can go the other way without a micro-osteoperforation, and I'm still struggling potentially 6 months later, just from off of one tooth. So it really does save a lot of time. It obviously is an increased productivity level, depending now if you want to charge for accelerated orthodontics. I do certainly in my office. It streamlines my productivity. You know, really where I'm going with all of this is that I want to get to the point where I'm Invisalign only. And that's been a slow process over the years. You know, I'm at, you know, anywhere from 45 to 50%. There's colleagues of mine that are at 70%. You know, my idea is to ultimately open, you know, an Invisalign only office where there's no braces. And that's where we're at, is to get to that point where you can treat everything with aligner therapy. But I got to tell you, there's no way that I can treat some of these patients without having some sort of accelerant in there. And so obviously it's gonna get you to a higher level of productivity the more cases you can start and finishing them in a timely manner. Here's just this was a husband and wife team, a husband and wife that came in. I treated both of them with Invisalign. She could not go into accelerated orthodontics because she had an autoimmune disease, and her doctor basically said, yeah, you're not doing that. So I was like, fine. Her husband went into aligner therapy as well, but he had micro-osteoperforations. They were both about 12 months of treatment. That was the treatment fee that we quoted them at the time. This is probably a couple of years ago, this case. And then there's my Propel fee, which was at the time was $1,000 for just the micro-osteoperforation. Today I do it a little bit differently because I often incorporate micro-osteoperforation with vibration coupled together in my cases. But you can see the difference in terms of the number of appointments. When we include from the very beginning scan to the final photos, 11 appointments is pretty typical for a 12-month case. When you incorporate all the different appointments you might have, from attachment placement to final retainers. And on the right-hand side here, the MOPS, he was done in 6 appointments, and no refinement. And so obviously that changes your ROI for any one of these cases. You're able to get through these cases a lot faster and about half the time. You increase your ROI, and it's less chair time, increased profit, and frankly, you know, I'm not the biggest. I don't have the biggest offices in the country. You know, I start anywhere from 700 to 800 patients a year between my 2 offices. But there's doctors out there that see 120, 130 patients a day, and I look at them and I think, God, you know, I used to be like, I wanted to be like that. I wanted to be those doctors that saw 120 patients a day. I can tell you, all these years later, I don't want to be that doctor. In fact, when I see 80 patients today I saw probably 75 patients today, 78 patients. I got to tell you, it's still too many. If I can find a way to see 40 patients a day, that would be much better. It's more relaxing, it's sustainable, it keeps the gray hairs away. To be honest with you, that's where we all want to go. And how do you do that? I push my Invisalign patients 12 weeks out. I push my Damon patients out 12 weeks. I don't see patients too often. The way that Damon works in my hands is the less I do, the better results that I get. Same thing with Invisalign. If they're switching out weekly, I give them 12 aligners and see them every 12 weeks. And I've been doing that for years now. In terms of doing micro-osteoperforation and vibration and switching out every 3 days, then I give them even more aligners. Sometimes I'll see them 2 appointments and then they're done. So that gives you a little ROI, kind of, you know, simple. Here's your sort of your manual osteoperforation devices that Propel has. The one on the left, that's the first generation. There's a little light activation. You set the meter, the handle there at 3, 5, and 7 millimeters. So when you perforate 3 millimeters into the bone, the light comes up. It's almost like the training wheels, if you will, of perforating appliances. It's a single use. You throw it away after you're done. Then the middle one came out a few years ago, and that's an autoclavable. You reuse that handle, and then the tips are disposable. So you're just buying the tips. And you can buy it with the sleeve on where you see those little hash marks, or you can not have the hash marks on there. That corresponds to how deep you're going, 3, 5, 7 millimeters. And then there's the power driver on the right, which is essentially all I use. My team does everything for me. They do the signing of the consent. They have the x-ray up. They do the chlorhexidine. They do the BTT, baddest topical in town, anesthetic. They then go and do attachments while everything's settling with the anesthetic. I come over with my contra-angle rotary, and I zip in, hit the reverse, zip out, and I can do full mouth in just a couple minutes. Seamless, fast, really the feedback from patients is phenomenal, especially that have had both the reusable handle one or the single-use one versus the rotary one. It really is much smoother than my twisty motion. The other part of that is that, you know, my wrist gets a little bit sore or after, you know, doing 2 or 3 perforations or 2 or 3 patients a day. So I like the rotary as well. Kind of saves my body a little bit on any given day. So that's out there for you to purchase from Propel. Not mandatory, but I think the torquing and the speed is just perfect for lending to being quick and very specific to areas, and patients certainly like this little rotary machine. And these are the sort of the parts and components to it. In terms of, I'm not going to bore you on how, you know, to use it. At the end of the day, if you want it, call up Propel. Your rep will come by. They'll show you how to use it. You snap it all together. Endodontists use this rotary instrument all the time to do quick endo. You know, setting the RPM at a certain height and all that, they can certainly go through that. Okay. Now the perforation technique, it's not always what you think. Obviously, some of you think like I haven't numbed up somebody in 20 years, or I feel really weird about perforating into somebody's head, and it's not that complicated. So it's all pretty straightforward in terms of what we're doing. In terms of what I've been doing over the years, as well as I think kind of collectively the KOL group has kind of come up with this as well, is that a lot of patients really are only going to need one treatment. And that's going to really take you through about 24, 25 aligners, or about 6 months of treatment. In terms of the amount of perforations, we're doing anywhere from 6 to 8 perforations per quadrant, and we're in a depth of anywhere from 3 to 7 millimeters, with an average of probably about 5 millimeters. I typically am a little bit on the deeper side, between 5 and 7 millimeters. There's other speakers that just want to puncture through the cortical plate, and then that's it. I think there's merits for both until the research is really clearly out there on that depth aspect. I'm leaning more towards a little bit deeper, but again, some of it is comfort level with patients as well. But in more complex cases where you get to the end, you do a refinement, or you've got a tooth that's a little bit stubborn, that's when I'll go in there and do a second treatment if I have to. Rarely, I don't even remember the last time I ever had to do a third treatment. So I think really we want to focus on really one treatment, one micro-osteoperforation treatment that then will last you for about 6 months or about a year, or about 24 or 25 aligners. And again, every single perforation has a 6 to 10, I said earlier 8 to 10, but about a 6 to 10 millimeter radius effect, and that's why we don't have to perforate certainly everywhere, you know, in the mouth. And that you know, that peak level of cytokines, you know, that's going to last you for, you know, 3 months, 4 months, and then that starts coming down. But at that point, you're really kind of screaming fast through treatment, and everything's loosened up, and you're certainly good to go. These slides really are kind of what my team's doing for me. They're basically evaluating where we're going to do the perforations, which are in approximately between the teeth. You're not getting down into the mental foramen or into the vascular supply. You're really in a safe zone. They'll have the x-ray up. They have them sign. There's a consent form. They have them take a couple Tylenol, hopefully at least 500 to 800 milligrams of Tylenol before they even show up, not do it at that appointment. And then they do 2 rinses of chlorhexidine 2 times, 1 minute apart in the beginning, before they do the Propel, and then after they do the Propel, they'll do it again. And then we numb them up. So we often use topical to do that. We want to check the anatomy and figure out where the roots are. You can really see where those perforations are going. And I like to do kind of a triangular effect like that, or vertical, 3 in a row like that. And again, the whole idea is to get as deep into that bone as you certainly can. And that's sort of what in the lower right-hand corner, that's what those perforations look like. They walk out, they look like pimples, and within a day or 2, they're gone. They're sore. Their bone could be a little achy for about 24 to 48 hours. We always let them know that. But essentially then what you're doing is you're really allowing the patient the opportunity to uncouple these more challenging movements and do it in a timely manner. And like the picture above there where you've got the canines that are impacted on the palate, we can drag and pull those teeth all day long, and unless your anchorage system, which clearly in this photograph is not a really superb anchorage system lined up just yet, but if you're not fully locked and loaded, those canines can really drag on for a period of time, not to mention where the roots end up as well. So doing some easy perforations on the palate just softens that all up and really makes the experience a lot more rewarding. Here's some more examples of sort of the checklist of where the perforations were done or where you're planning to do it. And typically where I'm doing these perforations is really around the canines and bicuspids. I'll migrate into the laterals and the centrals depending on the level of rotations and crowding of anterior teeth. Some of the interproximal root distance is minimal and difficult, especially in the lower anterior. Tissue is a lot thinner in that area. You can end up causing twisting motion of the tissue around the screw, which you have to be careful and make sure the tissue is really tight before you perforate into that bone. That's also why I like the rotary, because the rotary goes so much faster, like a Makita drill, if you will, into the bone than sitting there with the manual and trying to lace that into the bone, and at times that can be a little bit of a struggle. So just doing a little push there for that manual aspect. Propel definitely has all of these charts for you to, or forms to fill out, and this way you can keep all the documentation of where you're doing the perforations and who the patient is, what you did, and sort of a checklist more than anything. And I think it's nice to have that. And then again, a week prior, seeing the tray set up and what you need, and then the procedure in terms of what's going on aesthetic-wise and all that. So that's kind of the neat thing there. Chlorhexidine, again, is what we're cleaning the mouth with. In terms of, some of you don't love doing blocks or local anesthetic with needles. There's tiny little pedo needles that are out there that are hardly anything at all. There's the obviously the topical that's out there. Septicaine is pretty easy to use if you need it. I got to tell you, I don't often use Septicaine or needles. The topical that I'm using from Woodland Hills Pharmacy, you can always email me if you want the information on this, but this is a triple sort of cocktail of anesthetic. And the percentages are much higher in this cocktail. Very powerful stuff. You leave it on for only a couple minutes. Anything longer than that, you're going to slough the tissue. You really want to isolate this. You don't want to be using it, just painting this all over the mouth. It's going to flow to the back of the mouth. You're going to numb up the airway and the throat. You really just don't want to get in that. You just want to use little cotton rolls or cotton squares, isolate it, wipe it off, have the patient rinse out into the sink, and then just let it sit for about 10 minutes until everything is where it needs to be in terms of the tissue being numbed up. So obviously we want to be very judicious in where we place that, and so I think what's important to keep in mind is use these little cut pieces of gauze, leave it on for a couple minutes, 4 or 5 at the most, otherwise you're going to get that sloughing. And while you're waiting, once you've removed all the anesthetic, the topical, and you're waiting 10 minutes or so, this is also where we want to be doing something else. We'll put a bracket on. We'll do attachments at that point. We'll do IPR. We don't place attachments at aligner number 1. I've never done that for all the years I've been doing Invisalign. We wanted that first appointment to be nice and easy. And so that second appointment is when we do the Propel, and we can also then do the attachment appointment, and we can also do the IPR as well. So that's what these little cotton squares look like. It's isolated. It's pretty easy. It really, like, you're just trying to isolate that anesthetic while you're actually going in there and doing the perforations around whatever movement you want. You can get really creative in lassoing rubber bands or elastics around aligners. You want to just put them on these little squares here, and then you just kind of put them right there. It's isolated. It's not flowing everywhere. Just be really careful with this topical because it can get away from you. And then you can get all creative and use the bootstrap technique, use the Kaplan hooks, which is what we use in the Damon world. Those Kaplan hooks are great to put on to ultimately for crossbite correction, or in this case for moving the teeth into the aligners in case they didn't move at all. So that's sort of, you know, the process by which we go and we do these perforations, and again, that's what it looks like, untangling all these little issues. And usually you're about 3 millimeters in the anterior and more 7, the more distal area that you get to in the mouth. Okay. Obviously, we're using the micro-osteoperforation technique for anterior movements, for distalization. You can perforate around the 4s and the 5s, the bicuspids, and still have an effect on the molars in terms of distalization. You can be very local, very specific around localized teeth as well, without having to be perforating certainly the whole mouth. And it's just like anything, you just screw it in, unscrew it. That's sort of what we're looking at in terms of the using the device. Pretty easy, you know, overall. And again, the whole point of topical is to numb the tissue. It's that initial prick. Remember, there's no nerve endings inside the medullary or the cortical bone there. If you scrape against the PDL, just unwind and find a different location. The PDL always grows back in those situations. Obviously, the objective is not to hit the PDL, and the patient will let you know about that too. For 7-day aligner change, you know, really one treatment of Propel, doing those perforations in all 4 quadrants is all you're going to really need. Just make sure it's Tylenol in terms of the painkiller, no Advil, which is anti-inflammatory. Remember, we want inflammatory response. And, you know, we really need that inflammatory response because that's what certainly this is all about. Obviously, in terms of, you got to get the team on board. The team needs to be part of this whole process, and you got to train them in what they're supposed to do with Propel and with micro-osteoperforations. I think we've already discussed all the benefits of that, of Propel: shorter treatment time, better hygiene, you know, playing out all these somewhat difficult movements that just tend to drag on over the years and months of treatment. We obviously get phrases. There's phrases that we talk about in the consultation. You know, we talk about if you're interested in accelerated orthodontics, we can finish in about half the time. There's an additional fee. It's $1,000, about $80 a month if you really want to look at it that way. You know, Propel is not a new thing. It works really using your own body's biology by stimulating all these different bone cells to achieve better predictability and less time. The common analogy that I use, and my TCs are using these analogies as well, so I'm not necessarily the one who's saying this all the time, but one analogy I always use is turning refrigerated butter into room temperature butter. I don't know if this is a pet peeve to you, but when I go to a restaurant and they give me cold, hard, out of the refrigerated butter, it's really hard to grab it and put it on the bread. It just kind of falls off and you're digging at it. I love the butter that's like room temperature, a little olive oil in there, and like some rock salt like right on top. Like that's the best butter. And I'm not a big butter like connoisseur or anything. I just like my butter that way. And really Propel is the same kind of thing. And micro-osteoperforation specifically is that it turns the bone, if you will, into refrigerated bone into room temperature bone. It softens everything up. It allows ultimately us to get through treatment more predictably and a lot faster. You know, moms may say, or patients may say, I'm afraid of needles and blood. Again, we're using topical. You know, I'm not sure I want them treated with a new product. Again, this technology has been around. I mean, how long has Orthodontics been around? 40 years or so. This is really not new technology. This is just delivering it in a more modern vessel, if you will, a more modern technique and appliance. And also branding. I've been using Propel now for 4 or 5 years. People come in now and ask for accelerated orthodontics. It is crazy. It's the same way that Invisalign built that branding years ago. Put it on your website. You know, have it all in there in terms of you know, what it's all about. Have videos on there. The more information you can put on there, the more patients are going to refer to you or come to you rather. Now, in terms of how I'll kind of go through this fairly quickly in terms of because of the interest of timing, but whenever I do my consultations, we use a PCS model, problem, consequence, solution model. We explain the problem. We obviously have big photos on flat screens and televisions and big iMacs. We go through the problem. We explain to them what the consequence of that problem is long term. You know, you've got crooked teeth. Here's the long term on this. You're going to lose bone. You're going to lose tissue. Your access to cleaning is compromised. And then we offer them a solution. By the time I get through that consequence, a lot of them are feeling like, wow, my teeth are all going to fall out of my head. And we don't do that in a hard pressure, salesy way. We just sort of let them know, you know, what it is that we're looking at. And we're not making anything up. We're just kind of showing them about how healthier gums is a good thing. And we want to have easier access to cleaning, better functionality, better, you know, less trauma to the teeth. And that's certainly what we're trying to highlight with the patients. And obviously, when it comes to periodontal issues, we'll show them, like, hey, you have periodontal disease, bone loss, recession, because of the crowding in the mouth. So we go through that whole PCS model. I won't bore you on all that. Many of you probably already do this. But ultimately, we want to show them, you know, the before and after of patients and let them know how fast we went through treatment, but the upside of treatment and how ultimately you can get from point A to point B and get these beautiful results with orthodontics, whether or not this is fixed or this is, you know, aligner therapy. We want to be able to show them that. And there's so much upside with respect to straightening the teeth. All of you know that. And so where that comes in terms of the aesthetics, the access to cleaning, the functionality, the cardiovascular aspect of having straight teeth and what it can cause in terms of damage long term, all of that goes into that treatment plan and that consultation that we go through. And we go through that PCS model. We're showing them the photos, and that's when we really started talking about, you know, getting better predictability out of the movement in a timely manner, and that's when we show them micro-osteoperforations. We have it type it out. We show them how to do the perforations. We go through all the ins and outs, and we at least plant the seed. Not everybody wants to do it immediately. We plant the seed, and certainly there's times when people halfway through treatment or 4 aligners in, they're like, oh, I definitely want to do this now, and we can certainly start the micro-osteoperforation, you know, at any point. So getting into the cases, which is we're going to finish fairly soon on this, but this is just sort of a snapshot of my cases in terms of what I've done over the years with Propel and aligners. One braces patient here. But this is your typical patient that comes and sees me. They put an enormous impossibility on me to say, I need to be done in 12 months. I can't finish you in 12 months, or I can't guarantee it. He had 31 aligners, switching out every 2 weeks here over a year. I did 1 micro-osteoperforation for this case. That was about 6 perforations per quadrant. He switched out every 5 to 7 days. This case is a couple years old, no refinement, and that's the end result. So got the nice result that I wanted. I'll back it up so you can see it again. Obviously a class 1, we had a crossbite in the laterals there, really narrow arches, and then that's the end result, all with Invisalign. I love the result. You know, I can always Monday quarterback my cases. I don't love the arch still looks a little bit caved in on that left side, and the 6s aren't fully coupled. I didn't get a chance to do a refine with him. Pretty easy to fix those things. But this is 31 aligners later, done in 7 months. Here's another case. Class 1, deep bite, blocked out bicuspid, went to 3 other orthodontists who all said we got to pull teeth. He didn't want teeth pulled. This is a class 1. Like, why would you ever pull teeth in a case like this? The anterior teeth are all retro-inclined. That's where you're getting your leeway space. Narrow arches, the vertical is too deep. This is why would you ever try to put fixed ortho on a case on this? Because you're going to shear off your lower braces, and everybody wants to get creative with bite turbos and throwing, you know, triad and throwing, like, you know, flowable composite on the lower 6s to increase the vertical. Why? Why go there when all this is just screaming aligners? This was 32 aligners, no refinement, and switching out every 7 to 10 days, and that was the end result. Got that bicuspid in. I'll back it up. That bicuspid was blocked out, and this is a non-extraction case, obviously. Opened up the vertical. Never got the midline right. Couldn't get there. But the patient was thrilled. No refinement. Call it a day. And done in 8 months. And these are old cases, by the way. Today, I treat these cases with MOPS and vibration coupled together, and these cases are now finishing up in 4 and 5 months. Much faster, switching out every 3 days. Here's another, more periodontally compromised. You know you have to tell patients you're going to have black triangles in cases like this. So this is a black triangle, screaming black triangle crossbite case, 43 aligners. I did do a refinement on this case, and it finished in about 12.5 months. And there were some class 3 elastics that I'm running along the way. I always add class 3 elastics on cases like this that have that sort of underbite tendency there. And so here we go here. And you can see this was a progress. Here's the final after a refinement. So got a nice result in the end. Still some black triangles, did some slenderization. In the end, not able to close that more than that. Here's a 12 to 14 month case, 31 aligners, crossbite on the laterals. And again, this is a 5-day aligner change done in 6.5 months for this case. This was progress 3 months, and that's the final after about 6.5 months of treatment. No refinement. Here's a 100% deep bite. Look at that gold in the back. That gold always can be complicating when it comes to lining things up, because you really got to be able to suck that bite in at the end. Often there's a lot of wear facets in these kind of teeth, but blocked out bicuspid or a lateral there, 100% overbite, and this was done in 7.5 months. I did have 7 refinement aligners in this case, and that was a progress, and that's the final. Nice even opening, leveled the occlusal curvus B there. Probably could open the vertical up a little bit more, but opening up verticals is just easy today. With all the G5 advancements in terms of vertical opening, with doing micro-osteoperforation, vibration technology, these openings are pretty easy to create these days. A little bit of struggle in the past with those kind of cases. Here's the last case with micro-osteoperforation. Patient was missing a bicuspid, upper right bicuspid, and I wanted to get the canines coupled. Canine was sort of blocked out there, you can see in the picture. And so in this case, I extracted the bicuspid tooth number 28, and then I walked that canine back, and in about 8.5 months, that canine was vertical and locked in with the canine, and we finished her up. So these are good for extraction cases, class 2 cases, class 3 cases. It really doesn't matter. The body doesn't know, what it's called in terms of, nomenclature. It just knows it needs to, be moved, and that's certainly where all this is, coming from. In terms of, what you're able to do in the middle of treatment, you're going to get situations where teeth that intruded on you didn't extrude. It's pretty easy to go in there with bootstrap techniques, do a little propel, and do little V notches on the lingual there, and elevate those teeth. And these teeth elevate fairly fast. It can only take sometimes 3 or 4 weeks, and those teeth are elevated and they're good to go. You can get really creative with aligners. You can put buttons on aligners. You can create a couple equal and opposite force there to rotate the teeth using elastics across the aligners, throw some Propel in there, and then that ultimately lines up those teeth nicely. So all of this can be done fairly quickly. Even uprighting roots, those struggling roots, you can put brackets on those teeth and add a little slit in the back of the aligner, use some double elastics there, 4 to 6 ounces, and that just uprights that tooth nicely. And really, to get it done fast, that's where micro-osteoperforation really comes in. The last part of this evening is just the high-frequency vibration. I'm not going to go through it too much, other than it's just a 5 daily wear. It's an aligner seater. There is something very important in seating these aligners. We have given Chewies out for years to seat aligners. People have used other techniques to try to seat the aligners. At the end of the day, this works so well with the aligners in place. They bite on this 120 megahertz later, 5 minutes later, and these liners are seated. And we want them to do this when they place the initial liner in place. And so you're going to assemble this for them. They're going to do 5 minutes. There's a whole light indication, which I'm not going to go through, but essentially the blue indicates that its cycle is in progress. When you finally finish it, it will blink 3 times green, and if it's charging, it'll be yellow. Magenta really means low battery. So it's pretty easy for the patient to use and turn on. There's data that you can ultimately get from it, where you can plug the unit in and it will upload all the data and a snapshot from exactly the usage that the patient went through in the last whatever week or two, or 2 months that they were using the vPro 5. So that's a nice way to do it. In terms of the cases, I have a number of articles out there regarding vPro 5 and MOPS and all that. You can talk to your rep. There's a lot of them out there. A lot of the KOLs have really written some great articles. But if you want more information about vPro 5 specifically, just ask your rep about that. But to finish up, here's a teen case. I did micro-osteoperforation and high-frequency vibration, and this is a case to finish up in about 5.5 months, no refinement, and was switching out every 3 to 5 days. And I think specifically it was more 3 days than 5 days in this case. So that's the final. So here's the beginning, and then that's the final. And again, all liner therapy, all switching out every 3 days, no refinement at the end. So that's for me, that's pretty rewarding. Here's another case here, a little bit of a deep bite, anterior carotid case, class 1, pretty straightforward. 24 aligners, 1 mop treatment, coupled with high frequency vibration, switching every 3 days, no refinement, and that's the end of a case like that. So these cases obviously turn out pretty quickly. Here's the last case of the evening. This is a bilateral open bite. I treat these cases all the time with Invisalign by using sort of the meow technique, where we intrude the posterior teeth. This is something that we've been doing really from day one with Invisalign in terms of addressing these open bite cases. You're not going to extrude all these posterior teeth with aligners to get where you need to get. You'll always fail. In this case, I actually treated this patient with Damon. He wanted to go with braces instead of Invisalign, only luxating on the back, really the second molars, maybe a little bit on the first molar, but really not much more than that. We did MOPS, all 4 quadrants, 1 time, high frequency vibration twice a day. He was at least going to be a 2-year case, if not a surgical case, and I finished him in about a year. You can see in terms of my Damon brackets are on there. You can see some of the perforations in that picture. You can see the leveling 3 months later. Those arches, they're fairly level. Those teeth, I'll back it up here. That crowding is all kind of worked out, but look at the arch development that we're getting here. Some would argue that's Damon, and that's maybe true in terms of some of this arch development, but really softening everything up. It's unbelievable where it got me. And all along, I'm using elastics. I'm using reverse curves to pull up the posterior a little bit, so it's a little bit of reciprocal sort of closing. And then that's the end about a year later. And so locked him in. These were the final photos. He's going to end up having a veneer placed on that lateral there that's they had a history of trauma. And this is a pretty amazing case. This guy loves me, loves the results. This is what it's all about. This is the kind of stuff that, why go over and try to do, bring, edible arrangements or coffee to a GP office? They don't care about that. What they care about is this. And his dentist has called me a number of times saying, what you did for Nick is amazing, and he's sent over since tons of cases since this case was finished. And no amount of like muffins or coffee or whatever is going to get you that kind of response from a general dentist office. Anyway, so that's This is my final perspective on this. I do mention lunch and learns here only because I think it would be important to let the general dentist know that you are an office that's doing, micro-osteoperforations, accelerated orthodontics. It's not too late to be an early adopter on this. There's so many doctors out there that sort of, do it a little bit, but they don't really do it a lot. The purpose of today's webinar was really just the basics. This isn't more high-level talks that we can get into about how you really, push it to patients. What are the talking points? That's for another time. But I think all of us should really think about the early adoption. And I was at the AAO in San Diego in 2000. I guess it was May of 2000. Took my national boards there, my orthodontic Part 1 boards there, and that was the first Invisalign certification that they did. It was like about 1,000 doctors that got certified at the AAO, and many doctors ended up getting certified after that the next couple of years, and then a lot of them just stopped. There was 10,000 orthodontists certified to do Invisalign within a couple of years, and many of them stopped doing it. And all these years later, now all those orthodontists are coming back and now starting to do Invisalign because they realize it's here to stay. There's been massive disciples out there, Jonathan Nicozizi and Derek Bach and Neil Kravitz and all you, Ben Burris and all of you, who know all these doctors, and that they're advocating Invisalign, liner therapy, plastic, right and left. And so all of a sudden people waking up going, oh, maybe I should do Invisalign, and yet they're kind of already caught behind because there's all of us that have been doing it for now, well over a decade. And I would say that accelerated orthodontics is still in that same category. Get in there, start using it. It's going to be really rewarding how fast ultimately your cases are getting done, but more importantly, how predictably they're getting done fast, and also the happiness that we're getting out of our patients, the happiness of our team members who are going and not seeing 90 patients a day, but getting those numbers down so it doesn't, wear out our team members. And certainly there's a lot of branding that goes around using a product like Propel, and so I think that that's a lot to be said about that. So you can reach me at my email there. I'm pretty approachable. I'll be at AAO in the booth for Propel, probably be in the booth for Align as well, but come up to me and see me and say hi and tell me what you're doing and tell me what I'm doing wrong and tell me what I need to be doing, because like I said, I don't have all the answers, but I certainly feel like I'm on the right track. So I'll open it up now for questions. Anyway, I hope you all kind of enjoyed tonight in terms of just getting you a little bit on board on what products are out there with respect to Propel and how it's used. It's very simple. A lot of people say, well, how many perforations do you do? It all depends on any given case. And so, a lot of the time I'll do 4 to 6 perforations per quadrant. Typically, that's all I'm going to need to do. And that's going to last me for about 24 or 25 aligners, switching out every 5 to 7 days. Typically, I'm not doing 3-day aligner changes without V-Pro 5 incorporated with micro-osteoperforation. I'm typically grouping those two together, and they're doing the micro-osteoperforation, then we're getting into the vibration, and they're switching out every 3 days. That's really kind of where I get at that point. What am I charging for Propel? I charge $1,000 for the micro-osteoperforation. I charge $1,500 for the micro-osteoperforation and V-Pro 5 coupled together. Obviously, in terms of the charge, there are times when I will be reactive on a tooth and I won't charge anything at all. There's times when I'll charge. There's ADA codes, surgical codes for micro-osteoperforation. They usually pay about 80%. Sometimes that's all I'm going to charge. Sometimes obviously you can charge for the V-Pro 5, and then you could also then bill for the micro-osteoperforation on the insurance in case you're doing, again, both techniques. So in terms of vibration alone, I've been using the V-Pro 5 for about 2 years now, and it's been really effective at seating the aligners, getting them to the patients to really soften up the tissue and the fibers around the teeth. That has been really valuable for switching out every 5 to 7 days. One of the things when John Morton announced in G7 that you could start switching out to 7-day aligners, there was no mention that you would have to change anything to your ClinCheck setups. There's no mention that you would need to change any level of difficulty of aligner cases at all. He put it into a box that every single person can go into 7-day aligners. There was a disclaimer there that the doctor needs to use their own advice as to whether or not 7-day aligners, it makes sense. What I've found is that the more difficult cases, and if you don't have a patient who's wearing their aligners 20 hours a day and they're only wearing them like 12 or 13 or 14 hours a day, that's where you're going to start having tracking issues. That's where vibration technology really comes in and as an advantage to seat those aligners so you don't find yourself in a situation where the aligners are actually not working. Let's see, another question. Do I charge for V-Pro 5 separately? I do. I charge $1,000 for V-Pro 5, and then I also charge $1,000 for the micro-osteoperforation. If I'm doing the two together, it's $1,500. That's on top of my normal treatment fee. Again, that's my own pricing. This isn't anything that Propel has asked me to do in terms of the pricing. This is what what I'm charging out here in California, and some doctors charge $300, some people charge $500. It's really going to be up to you at the end of the day. And then with vibrations alone, do you stay with 7-day aligners? Yeah, you do stay with 7-day aligners for the most part with vibration, but I do trend more towards 5-day switch out, and I'll monitor the patient. If I feel if there's any kind of tracking issue, I'll go back to 7 days. And remember, we're doing 7-day aligner changes without any accelerant at all. But what I'm finding is that vibrational aspect really does help seat the aligners, decrease any little sort of discomfort that patients may feel with each aligner switching out. And so I personally am finding that the vibration just ensures that the 7-day aligner switch out for all patients makes sense, and that is an equalizer in that. And I found that that's working for me. So I think that's it in terms of questions. If you want to reach out to me again, you're more than happy to email me if you have any questions. And I hope you have an interesting time tonight and you've learned something. And we'll see you again. Maybe the next course will be a little bit more advanced. And we'll talk to you soon. Thank you.